The following portion of Bloom is sponsored by Docs Outside the Box and Kids Outside the Box.
Welcome back to Bloom. There's so much excitement as we gear up for Saturday's Bloom Health Expo, where you can meet some top doctors, including our next guest. Joining us now from Docs Outside the Box and Kids Outside the Box are Doctors Lana Gardner and Leah Teagle-Taylor. Ladies, it's always so great to see you.
Good to see you.
Hi, Gail.
And so we're so excited that you guys are going to be joining us for the Bloom Health Expo. This is a first for us. Of course, we're partnering with WFLA. We're going to be where the Tampa Bay Buccaneers train. And this is an opportunity for people to just come up, say hello, and see what sets you aside from other docs in the Tampa Bay area.
Absolutely. So we are very different. We see ourselves as creating a new medical model, one where we educate the patients to learn what's going on in their body, what is it that Western medicine has to offer them, and what are the alternatives to that, and or combinations, and then the patients become empowered to make the choices themselves.
And what's so great, I've been to your facility, was absolutely, it's so beautiful. You just expanded, we celebrated that. And what I think people are going to find so refreshing is that this is a one-stop shop. It's for the whole family, not just for adults, right?
Exactly.
Yeah, and so you treat the kids. Tell me what sets you aside when it comes to children, because I know you go through so many lengths to make the entire family feel comfortable.
We do, Gail. We like to see the entire family. That's how it was meant to be, I think, in the beginning. So we see the adults, we see the moms, the dads, the grandparents, and the children. Everyone could come to the office there, and really that's how you deliver good care, is by knowing about the family and about the dynamics behind what the person is presenting. So everyone's welcome. We have urgent care, we have primary care, we have cardiology, we have outpatient GYN. There's something for everyone there.
Yeah, it's interesting that you should say that, because every time I go to the doctor, they want to know my family history. Same for my kids. If you're all there under one umbrella, it's incredible. You mentioned some of the treatments options. What other kind of problems do you help patients solve?
Well, we love regular problems, but we also love puzzles. And puzzles are things that are annoying to other doctors, meaning problems that they can't really diagnose or have a clear-cut treatment for. We consider that a challenge, and a really good example is long-haul COVID, which people didn't even know about, obviously, before the last few years. We've developed lots of effective treatments for that, using medication, vitamins, IVs, ozone, EECP, things really outside the box to help people get past the horrible condition that was COVID.
Yeah, and I know that our healthcare system is backlogged, but what I find also so refreshing about Docs Outside the Box is that you treat each person, each individual separately, like it's their own case, so you can kind of piece together and unpack what's going on with every patient.
Absolutely. Every person, every time.
Yeah, because every person is different, and 100%. So sometimes people might just straight medicine, but you also offer a holistic approach as well, so you're dealing with the problem instead of just always writing a script, which scripts have their place.
Absolutely.
But there's things that can enhance someone's health.
Absolutely.
Can you give me some examples?
I'd love to. Let's do a urinary tract infection. Most important to understand is that we will follow standard of care, same thing that happens in any other clinic. We'll dip the urine, send it out for culture, and then talk about antibiotics. If we feel it's safe and the infection's not in the kidneys, we'll give the option to clear it with herbals. Based on the patient's choice determines how we track them. So if they use the antibiotic, that's standard of care in this country, our job is over. If they choose to use herbals, we'll ask for a urine sample every 2 weeks, and that way we watch them get better. Sometimes it doesn't clear and we need to go to antibiotic use, but then we discuss that with the patient and they make the choice.
You're getting options. Yeah, it kind of gives you the power to take control of your own health and work with these knowledgeable doctors. So excited that you guys are going to be at the Expo. Thanks for joining us today.
Thank you, Gail.
Thank you.
Absolutely. Docs Outside the Box and Kids Outside the Box are located in St. Petersburg. You can call now 727-498-8898 or visit online at docsoutsidethebox.us. And again, we're super excited to have Docs Outside the Box and Kids Outside of the Box participating in our Bloom Health Expo coming up this Saturday, July 15th from 10 a.m. to 4 p.m. inside the Tampa Bay Buccaneer Advent Training Center. We hope to see you there. There's more Bloom right after this.
The preceding portion of Bloom was sponsored by Docs Outside the Box and Kids Outside the Box.